All right. It looks like we are, oh, wait, we still have a couple more folks joining. All right. John, should we kick it off?
Yeah, so I'll go ahead and kick it off. Everybody, welcome to the July meeting of the Small Business Program Advisory Committee. I'm John Frank, co-chairman of the committee, and I must add, we're actively seeking another co-chairman for this committee. So anyone interested in fulfilling that role should contact either myself or Mimi regarding that possibility. Today's agenda has some very interesting topics on it. We're gonna get an update from Mimi on the small business program, and then have a presentation or a kickoff on a discussion about the PEO study being conducted by the Maryland Insurance Administration. After that, we'll get some of the enhanced enrollment design updates from Danish, the IT specialist at the exchange, followed by a discussion and any public comments that we have. So with that introduction, I'm going to turn it over to Mimi, and you can go ahead with the first agenda item, which is before I forget, we got to approve the minutes. Amelia sent out the minutes on the 15th of July. They're excellent. Again, the combination of the recording and the transcription really gets the essence of our discussion down pretty well. So do I hear any changes or additions to the minutes? Hearing none, we'll mark the minutes as approved by unanimous consent on today's date. Mimi?
Thank you, John. Just have a couple of updates as far as everything we've discussed in the past regarding the portal. This new enhanced enrollment portal, we are on schedule with our timeline. Our RFP was issued on June 17th. Excuse me, someone's trying to be admitted. I just had to admit them. All right. And our RFP was issued on June 17th and it was closed on Friday, July 26th. Our timeline is on schedule again for the RFP. The evaluation committee is reviewing the proposals and would likely make a recommendation in the first week of August, and then the contract will be presented to our board for approval. And as discussed in our last meeting, we discussed tobacco rate surcharges in Maryland, or MHC for small business specific to the exchange. And MHBE will not be moving forward in implementing the tobacco rates for plan years 2025 and 2026 due to the lack of interest expressed from our carriers in the last call, and also citing our limited resources and budgeting in small group. Um, was someone raising their hands or trying to speak? If you are not speaking, please mute yourself so that everyone can hear the presentation and others who are speaking.
Mimi, I had a quick question. Can you tell us how many bidders there were for on this RFP? How many respondents?
Actually, I don't think I'm allowed to discuss that. If I am, I'll check back with procurement and I will let you, I'll just send an email with a quick recap.
Okay,
Yeah,
because it is closed, correct?
correct, it is.
Okay.
I have someone trying to attend. All right. So with that, we can move into, we moved pretty quickly. I actually had the agenda as 1:30 for this discussion, but we can move right into it if no one else has any questions for me about the updates. All right, then what I'll do is, so we've talked about PEOs and my study bill, just in general, and at a previous meeting. And today we have MIA's Associate Commissioner David Cooney and one of his staff members in this meeting to engage with our group as they gather additional information for their report to the legislature that's due at the end of this year. And they've recently held a public comment forum to gather more information from the wider public in Maryland, and there was some good interaction there. And so first, what I'll do is turn the floor over to Mr. Cooney for introductions and to allow him to say a few words regarding the study bill.
All right. Thank you, Mimi. And yes, as Mimi said, I'm David Cooney, the Associate Commissioner for Life and Health at the Maryland Insurance Administration. So my division, we oversee consumer and provider complaints against health insurance companies. And we also review and approve all the actual health insurance and life insurance contracts that are sold in Maryland. And then really anytime for any legislative issues that have a life or health insurance impact, my team is usually, we're the subject matter experts. So we usually kind of take the lead on those types of issues. And so in this case here for this PEO report, I mean, the MIA's goal for this report is really simply just to collect information to allow us to research issues that were identified by the Maryland General Assembly, and then provide a fact-based objective report back to the legislature on our findings. The legislation did not direct us to include any specific recommendations in our report, and so we don't intend to include recommendations. We really don't have a specific agenda or narrative that we're seeking to support with the study on our end. We certainly understand the concerns on both sides of the issue, but as an agency, we don't have a formal position on the issue of whether or not small employers should be allowed to purchase large group insurance through a PEO. That's really ultimately a policy decision for the General Assembly. But absolutely, consumer protection is always a significant concern of the MIA. So we'll definitely want to ensure that if the legislature does choose to make any changes to the law as a result of the study, that there's definitely appropriate consumer protections included. For today, we're here primarily just to listen and gather more information from stakeholders about the types of things we should consider as we conduct our research. And I definitely think everyone on both sides of this issue would agree that the most important thing in the context of this PEO issue is ensuring that all small employers in Maryland have access to affordable, comprehensive health insurance coverage. So we really need to just look closely and see what the potential impacts on that could be. And also with me today on my team also is Matt Weiss, who is part of our legislative and policy team at the MIA. So he'll be here as well. But that's really all I have. Like I said, I'm here to really hear from all, you all and just kind of listen to the discussion and see what kinds of issues you're concerned about.
Thank you, David. So I guess I'll just go back to this slide, which we've reviewed in the past, that has MIA's statement from the testimony regarding that study bill, and that says basically that Maryland is one of three states, and I believe the other two states are Alaska and Maine, that effectively prevent a small employer that has engaged in a PEO from participating in the PEO's large group health plan. And a Maryland small business, a Maryland small employer may engage a PEO to perform human resource and payroll services and may take advantage of pension and retirement plans sponsored by the PEO. However, with respect to the health insurance, Maryland law looks at the number of people at the workplace employer level in determining whether the health insurance issued to those individuals must meet small group versus large group requirements. Um, and then the parameters of the study in general state that the study required by SB 821 will include the identification and comparison of the regulation of PEOs under federal and state law in other states, the history of PEOs in the state and in other jurisdictions, including ranges in the PEO industry over time, the review of PEO health plans and benefit designs, the review of the requirements related to the engagement of PEO services and access to PEO sponsored health plans that must be met by a business, the examination of which other states determine the employer's group size at the level of the workplace employer, address potential impacts to the Maryland small group market if Maryland were to change the current law regarding the group size. That's a quick summary of these parameters, but we have John and I just kind of brainstormed a couple of questions to kind of guide this discussion. And one of the questions that came up at the previous meeting MIA held with the public was what um, makes Maryland a unique landscape. It is one of the three states that prevent PEOs from engaging with small businesses. And so we can start with that question, and you can raise your hand if you'd like to make a comment and um, address any of the questions. All right, Eugene has his hand up.
Yes, the PEOs that I've run into in the state of Maryland, um, that has been one of the so-called benefits of joining the PEO is that the small employers would have access to their health insurance, and I see that this is not true in the state of Maryland.
So
Yeah, so Gene, what you're saying is correct. In Maryland, a small employer by definition must abide by Maryland law in terms of purchasing their group health insurance plan. And there's no ability for the PEOs to offer what they have developed as a large group plan to those small groups. In other words, aggregating them into the larger pool. There's a number of questions, obviously, that come up in that scenario, which is what happens to the existing small group market in Maryland that has been on decline somewhat over the last number of years. And even though the PEOs wouldn't be perhaps interested in consolidating all the 10 lifer groups in the state of Maryland, they would be interested in the other groups of eligibility at higher numbers, 25 and up, to into their group plans, which, as I understand things, are somewhat medically underwritten based on the fact that they fall outside of the state of Maryland's jurisdiction in terms of governance or those sorts of things, which would have to be addressed in any allowance of PEOs to penetrate the small group market. How are they going to be regulated and the like? We have some other questions on that to share, but I'm really interested in getting other people's opinions as well in terms of what impact this may have on the small employer pool here in Maryland. And the regulatory environment in which this state has operated for a long time. You know, we had small group reform in 1994. That was one of the leading systematic changes in the country to allow guaranteed issue in our small group plans. It's a problem from before that was resolved in 94 and further strengthened with the Affordable Care Act coming in to add some plan design parameters and affordability issues as well. So that's kind of the essence of my opinion. And I see Daniel has his hand up, and then Glenn, we'll get to you after that. So Daniel.
Hi, John, and hello, everyone. The question I have, I know DC tried to introduce the bill not so long ago. Do we have any data in terms of what they were able to find out? Because I think to my recollection, that bill did not, either they pulled it back or it didn't go through.
Just in clarification, in DC, something to do with PEOs, offering PEOs to small employers in DC?
Yeah, so the small group market, I believe there was a bill that was initially introduced in DC to allow PEOs to enter the small group markets. I think it was around, I'm doing my 2021. Did we find out what happened to that bill and why it didn't go through?
No, actually, and I'll step in here. I've looked at that. There's just one testimony that I found from the DC Health Links Mila Kaufman, Executive Director of DC HealthLink, and I did not trace what happened to that bill, but I'm not sure if other states are in consideration for your study with, for MIA. I'm not sure if that's in your study, but I don't know if that's something you're looking into, especially
Then,
with DC having to go through something like this recently.
then my question to David then would be, are you, even though you're not, submitting any recommendations, but are you actually going to be submitting best practices or other jurisdictions that have actually tried to do this, and what are some of the outcomes that you found out?
Sure. So, yes, we are supposed to, as part of the study, look into what other states have done, how PEOs are treated in other states and under federal law. So that will be part of the study. And basically, there won't be recommendations, but to the extent there are laws on the books in other states, we'll definitely be reporting on that. I think one issue, I mean, a lot of our research is very preliminary, but a lot of states, I believe, are just silent on the issue, which therefore allows this to occur. Like Maryland law specifically prohibits this from occurring. So in the absence of the law prohibiting it, it's permitted, but it doesn't necessarily mean the state took a kind of a proactive, deliberate approach to allow it. It's just more that it's not prohibited. So, but we'll certainly look at that DC bill. I don't know offhand the status of that either, but that will definitely be one of the things we will look into as part of our report and study.
I totally agree that, would probably good for them to know, like a neighboring jurisdiction like DC, like why they decided not to move forward with such bill. But thank you, Mimi.
Thank you, Daniel. Glenn?
Well, thank you all for attending this meeting. And first and foremost, I want to, just make sure everybody understands that I've been in this business for 31 years and started my career with United Healthcare, Mamsie Optimum Choice. They got acquired by United Healthcare, and started my own individual practice 20 years ago. And so the first thing I want to say is that, there were a lot of carriers in the market back then, and they all got gobbled up by the big players in small group. And in 94, as John alluded to, Maryland was one of the states that actually implemented guaranteed issue reform in 94. So one of the big things that I find Maryland different and, differentiate themselves from other states, including DC, is when, the ACA, the Affordable Care Act, went into effect in 2010. By 2014, you had guaranteed issue plans, small group and individual. But Maryland had a very robust already pool of employees from small employers, 2 to 50 employees, that had about 500,000 lives insured. And, over the years now that I've been in this, the rates keep going up anywhere between 6 to 7 to 8 to 10 to 12% in small group. And if we invite a PEO to get into the 2 to 50 employee group sizes, what's going to happen is you're going to see cherry picking. I'm going to use the word, but what it means by that, or lasering, what it means by that is what these PEOs do. And by the way, I'm actually a channel partner with 4 different PEOs in large group, 51 and over. So what these PEOs do is they bundle all the benefits, including workers' comp, 401k, health insurance, dental, vision. All these things get combined into one administrative fee that they charge the small employer. And then that small employer is in this big conglomerate master plan that they purchase for competitive pricing when they're small. And oh, by the way, you can go down to 2 employees, John. You can go all the way down to 2 employees if you want to. Okay. So these PEOs, if they do, meaning if this is opened up to 2 to 50 employee group sizes, believe me, they will start thinking about trying to find every opportunity to pull the big pool together, because we're all, insurance is large numbers, right? So here's our 500,000 pulled lives back in the day in 94. Now it's down to 250 lives. And to substantiate that, when what they do is they take a system called a GRX system. And if there's any broker on the phone that's in group insurance, what they do is they take the name, date of birth, zip code of these people, put it in this system and find out if they're healthy or not. If they're taking medications that are warranted, that they're going to be costly, then they say to the broker and agent, oh, go ahead, keep your group plan. We'll do the other stuff. But what they do, again, I'm going to use the word cherry pick, but let's say they take the healthy people, put them in this big master plan, and then that small employer gets the benefits of a lower premium, maybe, than they would have in small group. And hey, look, that's all good for small employers over the years trying to find a way to save money. But here's where I'm really concerned about this. There's two major points, or actually three. One, customer service. The agent and broker like me then has to go and request to get in touch with the benefit broker who's handling it to make sure everything's taken care of, number one. Number two, transparency. Once you buy into one of these plans, some of them have 1-year contracts, 2-year contracts, 3-year contracts to try to pull out your 401k, your workers' comp, all these other things, health insurance. It renews, by the way, once a year. You got to try to figure out what's the best thing. And sometimes it's hard to pull out. So that's another issue. Okay. And then the last issue, which is probably most important to every Marylander and every citizen in Maryland, is the fact that these people, when they pull the healthy people out, that pool of 250 lives is going to dwindle, and the unhealthy people are going to be in the small group pool. So 6, 7, 8, 12% is going to go to 15, 18, 20% for the carriers to sustain that. And then lastly, I'm just going to say, Mimi was kind enough to send me the DC bill. I read through it in its entirety 3 times. And one of the reasons why the executive director said she did not want that there was because they had 100,000 lives insured, and they were trying to keep the sustained price increases relative to keeping that pool healthy enough and not having them pull the unhealthy people out. And then last but not least, I'm going to say, when I worked at Mamsie, my last 5 years there, I ran the state of Delaware for Mamsie, and it was an underwritten state. And we had 25,000 lives I was responsible for. Well, guess what? Delaware had its own state product that if they didn't pass medical underwriting, they would go there. And let me just say something to you. Those rates were not competitive. So here's my point. I'm open to competition, and competition that can help Marylanders. But in my opinion, all it's going to do is increase the cost to the small group pool, and the people that get that are going to have trouble pulling back out of it. And I have 250 clients in small group right now, so I have a really good feel for this. And those are my comments. I just want to let everybody know that I think some things have good intentions, but the end result sometimes are not the good results of the intentions.
Okay, thank you, Glenn. Amber, you've got your hand up, Amber. Is it Amber still on the call?
Yeah, hi. I'm so sorry. I was having trouble with my microphone.
Okay.
I just really wanted to, I'm not normally the broker who will just, come on and concur with whatever the previous broker says. But I mean, really, Glenn speaks from experience. We have had both experience in that at the carrier level as to what the PEOs, how involving them can actually take away from the companies that implement. Absolutely, he is 100% right. It is cherry picking. It is taking the healthy ones off of the plan. They're not going to want the sick people who are on the plan. 3 or 4 sick people in 1 year can really increase the rates incredibly, and it can actually make carriers decline to quote. And that's what we saw years ago when PEOs were allowed in the market. This isn't the first time that it's been introduced. It was kind of like a working force, and it was taken away because of these reasons. So I really just wanted to kind of, double down on what Glenn was saying. He's absolutely right. For the brokers who have done group plans, worked with group plans over the years, we saw it. We saw the effect that it had. We saw the cherry picking. We saw taking the healthy people out, leaving the sick people in the group because they don't want the sick people. And then that does increase. You can look at, 50, 60, 70% increases with the employees that are left in the plan. So I just wanted to add that. Thanks.
Okay. Are there any PEOs representatives on the call today?
I don't think so.
No. Okay.
We haven't heard from other employer groups in the committee, and then possibly carriers, if carriers have a position on this.
Do we have any employers on the call today? Hearing none, do we have any carriers on the call that have any comments or concerns about PEOs entering the small group market?
I'm an employer. Good afternoon, everybody. I'm Judith Walker.
Oh, hi,
and
Judith.
I'm with NurseLinks, and we have healthcare staff. And my concern has been that I have been unable to find reasonably priced healthcare insurance for my staff. They usually have to go to the Maryland website and connect to as an employer. It's too for what they have the Medicare medical MD connection, and I'm wondering why is that the case? Because then they penalize insurance.
I don't, Judith. Sorry, but I don't know that we picked up everything that you said. It is true that individual subsidies do make the individual market attractive for smaller employers that don't want to offer a health insurance plan or find a group plan to be too expensive. This discussion is about allowing PEOs to access the small group market. They're not subject to the Affordable Care Act standards in terms of coverages. And as Glenn pointed out, use some medical underwriting processes to determine which groups are acceptable and which groups are not, if that's true. I'd like to certainly get a deeper dive, and I know the MIA is doing that. Is they're soliciting input from not only groups like this, but also other aspects of the industry, PEOs themselves, and how they operate, what the market conditions, what the market regulations are in other jurisdictions that allow it. So other comments or Judy, are we on the same wavelength here?
I can hear you. Can you hear me?
Yes.
Yes, I was saying that as a small business owner, I have been unable to find reasonably priced insurance to provide for my staff. And so I actually wanted to find out what are the options, because when I go to Maryland Connection, it's cheaper for them to get it by themselves.
That's true. That can be true. There are some advantages to employers to sponsor plans that are greater than just the cost differential. Obviously, being able to take health insurance premiums off as a tax deductible business expense for a small business. employee satisfaction and keeping their group insurance together as an employee benefit. There's a number of reasons that employers offer plans, even though they may not be the cheapest way to go. But the method that you're using, not sponsoring a group plan, but informing your employees that they can go to the exchange and acquire quality health insurance with no underwriting, is a strategy that many employers are using these days.
Yeah, because I give them the option because I show them how much it would be, and they're like, "Well, we don't want that. That's too much." So that's been my problem. They just don't want to, pay that much. Even with me, my contribution, it's still so much higher, and I just want to know why is that? Why wouldn't it be the same or better than if they went by themselves?
There are.
So, John, I raised my hand, but
Yeah, go ahead, Glenn. Go ahead.
Out of here to
Yeah,
Judy.
sure.
So over the course of time with the Affordable Care Act in Maryland, initially the premiums in 2014, when the pool was very small in lives insured, the rates were actually going up a little bit higher. And Mimi probably has a chart for that, where the individual market was actually a little bit higher than small group. But then over the years, this is my perfect point about PEOs and how decreasing the small group pool can affect premiums. Now the pool that was small group of 500,000 lives is 250,000 lives, and the actual individual market has actually plateaued off, where there's more healthy people that are in the population in the pool of Maryland enrollees, which I think, Mimi, I might give a good estimate. It's around 200,000 lives in that pool. And they've gotten enough younger people in that pool where it's offsetting the costs, where the insurance carriers are not increasing those premiums as much as they are in the small group pool. And then secondly, when you do have federal subsidies that are provided by the federal government with the ACA in all states, including Maryland, they're getting federal subsidies based on their income to help offset their costs. And then in Maryland, we also have state subsidy dollars. So, and I think, correct me wrong, it used to be up to the age of 30, but I think it's up to the age of 37 now, where a single person or somebody that's 37 can also get state dollars that are available to help offset those costs. So as a small employer like yourself, you actually are in a situation where, like John said, it may be, if you aren't ready to budget for a small group plan to control the benefits of that, get 7.65 FICA tax credits back, and some of the implementation of hiring people and letting them know you have a group plan, then that's what is available. Now, there is one other thing. And again, you can talk to any broker. I'm not trying to promote my own self, but there are ICRAs out there. It's called an Individual Consumer Health Reimbursement Account. And you may be a good solution for that as well. However, if they get federal subsidies, they can't get the federal subsidy and the HRA reimbursement amount to apply that you could provide for them. So there's another alternative that you could look into. Talk to one of your close, insurance people, and they'll give you some information on ICRAs. But that could be another alternative, but they can't participate in both. But if you give like $300 or $200 to help them, the ones that get subsidy can use that towards their deductibles, their copays, and stuff like that. So just, if you have a broker professional, talk to them. Some of the people on the call, they probably are aware of what I'm talking about. And, that's another alternative.
And I'll
Okay, thank you so much.
step in here. Judy, we can touch base offline about this, and I'll connect you to the correct resources as well. But everything you've heard
Thank
in this
you.
group is also very helpful. But to direct our conversation back to this meeting and PEOs, I did see a couple of folks roll in from, I believe, the other meeting maybe, or another meeting they were in internally. I did see Care First come in. Uh, do you have any comments about PEOs? I know you might have missed some of the discussion, but any comments, anything that might help MIA in their report and their study bill?
Hi, Mimi. Like others have mentioned on this call, the dynamics in the small group market has certainly changed, and we're really in the midst of doing our own deep dive on some of this as well. So, more to come from Care First in the future, but appreciate all the discussion so far.
Thank you. Thanks, Nikki. All right. Any other comments from the group? And MIA, have we addressed the points that you wanted us to address, or do you seek any other input, any other questions you may have?
I guess the only it's one of your bullet points here, but that I'll just bring up again to see if anybody has thoughts on it is if the legislature were to decide to allow PEOs to enter the small group market, what types of regulatory controls should be proposed? So this is them, and if there's no thoughts right now, just to be helpful if stakeholders are thinking about that in general, like what kind of protections should be included if the legislature ultimately goes that route?
Rob Cohen has his hand raised. Rob, you want to have input on that question?
Well, actually, I wasn't. He was asking that question right when I raised.
Well, you raised your hand. Okay.
But what I would say is that if you're going to put any regulatory moves on that, would be to, as Glenn Arrington had stated earlier about being that PEOs do cherry pick because they do use a MEWA or multiple employer trust. When and I've experienced it anecdotally. I have several stories about that with my DC groups that have been able to jump in because they have a very young, good risk type. And then I've had some that were not in the right industry, or they were cherry picked because of bad experience. But I mean, that really needs to be considered, because it really isn't fair to put the Maryland pool into a bad, too dirty pool, if you will. And I think that should be highly considered. And that's my comment. Thank you.
Good point, Rob. Yeah, that would be a key consideration, is the fact that those plans offered by PEOs would have to meet the criteria of guaranteed issue, no exception, to kind of be the same offering to Maryland citizens that they can get through the state. So that additional regulatory requirement on the MIA has budget considerations as well. Glenn, you have your hand up. Did you want to chime in on that? You're on mute, Glenn. You're on mute, Glenn.
Yeah, sorry about that. I was trying to figure something out there briefly, but I think one of the things is the Fair Practices Act that has to be considered about how to have consumers be able to apply for health insurance. And I think the other thing that I would say is there has to be complete transparency that's involved. And I know I was in the hearings meeting with somebody who said that there is transparency. And I think that regulations have to be involved if the state moves forward with this, that brokers that are currently, servicing the account has to be attached to the master plans, because what happens is they pull these employers out, and what they do is they put them into an employee identification number. So they're like co-employers. And what happens is that agent and broker becomes the servicing agent, and we have to work through the PEOs, whether it be a payroll vendor or a separate PEO company, but we should have access to those accounts to the point where we should be involved in not only commissioning of the product, because that's how we get paid as an agent and broker. Let's face it, we're not a fee for service company, right? We get paid a fee for service to give them HR, give them compliance tools, give them all these things that we're giving them in small group for this small employer who doesn't have an HR director. Now we're putting them into this big PEO, and then the agent and broker, what they receive is what they call a admin fee. And like I said, I am a partner with several of them, but in my opinion, I lose some of the credibility of the service of handling the day-to-day. And these small employers are used to somebody like me that they call, and then I can go to that carrier and directly support them. So that's those are two of the key points. And I think the other thing, and I think Mimi brought this up on the hearing call, David, is that some of the benefits that are included in the ACA can be carved out in a PEO to help offset some of the cost. So we need to make sure that these products include every single ACA component if the state of Maryland chooses to go down this road of allowing PEOs to get into the 2 to 50 market and choose to take the healthy groups out of it. But those healthy employees should also still get the same benefits that they would get in the Affordable Care Act plans, which in some cases may not be entirely the case.
Thank you. Any other comments for MIA representatives on the call today? Well, David, thank you very much for joining us today, and your colleague as well on the call. We appreciate the opportunity to provide some feedback from the exchange perspective and stakeholders in the exchange process. Thank you.
I did want to state that we have recorded the meeting, and meeting minutes will be sent to you as well, David.
Okay, great. Thank you.
Thank you.
All right. And now just one last reminder that we are still accepting written comments for about another week or so. I wish I should have checked the date. I believe it is
The 9th.
All right, thank you. Yes, through the 9th. So anyone wants to submit written testimony, we'll still be accepting that through August 9th.
Thank you.
Thank you. You're welcome to stay, David and Matt, if you'd like to hear the rest of our presentation. But all right, so we have up next Dinesh's updates about the enrollment portal and focusing more on COBRA. Dinesh, would you like to take it over?
Sure, Mimi. Thank you so much. Good afternoon, everyone. Today, I'm just going to give a walkthrough on the COBRA experience. If an employee comes to our self-service portal, how they can enroll into the COBRA and renew as well the disenroll. Same thing from the employer perspective. So let me share my screen.
Okay, would you like me to stop sharing?
Yes.
Okay.
Okay. All right. Do you all see my screen? You all see it?
Yes. Yeah.
Okay.
It's a nice chart, though.
Yeah, I'm not in the chat window, so if you are typing anything, I may not know. So what I'll do is I'll go through the employee experience, then I'll take a pause. I'll see if there are any questions.
Can you enlarge it?
Then I'll go to the employer experience. Okay. All right. So this is an employee experience. So the scenario is let's assume the employee got terminated by the employer. The employee sign in to his portal, our MHBE portal. This is exactly what he will see. So we are based on the best action the employee can take. In this case, our system decided, hey, he's the, it's ideal scenario for COBRA enrollment. So we bring in that action right to the landing page. As soon as they sign in, this is exactly what they will see. So if the employee, if they scroll down, they can see what is the plan they were and how much they are paying. And along with that, we also have a specific action that the employee can take. Of course, these are disabled for them not to take. So they can pretty much see all the plan details as well, their broker information and the employer they left. So all the information is available in the system. Now, employee can just tap on to enroll into the COBRA. So in this case, of course, the main reason is termination of employee, so they can choose the date they got terminated, right? Now they can say who other people need the COBRA coverage, just select it, then submit it. That's it. So it's a very simple tab. They just need to select who other people need the coverage and done. Now, now in this case, they already enrolled into the COBRA. So there will be two possibilities, right? So the employee has an option either to disenroll from the COBRA. Probably they might have got it other job, so they don't need this coverage anymore. So they can disenroll it from the current employer. That's one thing. Then there is another possibility that they could do the renewal of it, right? So in this case, just disenrollment. So they just tap on the disenrollment. So during the disenrollment, the system kind of shows who are the people being covered part of the current COBRA. So they can select by default. The system automatically selects all the people who is part of this COBRA coverage. Then they just need to tap on the button.
Sorry, I don't mean to interrupt you, but I think Glenn had a question, and it might have been about the previous, the initial screen you were showing. So,
okay.
And I might stop you like that if I see a hand up. So, Glenn.
Yes, just real quick. Does that include the price of the 2% COBRA administrative fee when you show them the price?
No, it does not include the administration fee because that fee is assessed typically by the TPA, correct? So we're not assessing that fee.
I just wanted to make sure I knew what the rules of engagement are and how it's being priced, because normally a COBRA provider is going to charge a 2%, to just administer, send everything out and all that. So I guess you negotiated with the TPA vendor not to charge a 2%.
There is no TPA vendor for this portion. This is an MHC for small business process. And so there is no vendor that's administering this. We're administering this.
Okay, so again, just to clarify, so there's an advantage then to be in the small group Maryland Health Benefit Exchange small group plans because there's no 2% COBRA charge.
Correct. That's one of the features. That's one of the added benefits, but there are pieces where the employer has to take the responsibility of administering that. But we'll get there when Dinesh gets to that screen, and I'll show you where those situations happen. It's typically when the spouse and the dependent has to be notified. That our system currently does not provide us a direct username and password access to the dependent and spouse. And so when the employee receives the notice, or the spouse, the employer will receive the notice, and then they will provide it to the spouse and dependent, and they will provide that back to the employer, and the employer will go into the system and make those selections for the dependent and spouse. But when we get there, I'll expand more on that. That's the only time where the employer is required to take action on behalf of the participants, the COBRA eligible participants. But the other aspects of this COBRA is really done through our system. And it's hopefully it's seamless. And I do see Wes's hand up, but Glenn, did that answer your question?
I just want to say thank you, but I just wanted to stop just to make sure I follow along. You know what I mean? As it comes up.
Okay.
Yeah, maybe, yeah, quick question on the, so I think it would be important if the employer does have some responsibility, especially around notice to the employees or the qualified beneficiaries. Would that be very clear, because the penalties of non-compliance for issuing those notices are pretty, they're pretty steep. And then just ensuring that the employer would know like what forms of confirmation of delivery are appropriate or would be honored. There has to be some mechanism to indicate that yes, the employee or the beneficiary did receive the COBRA election information, and it can't just be like, hey, I gave it to them, right? That won't hold up if it ever goes to litigation.
So are you suggesting that our system asks the employer whether they've absolutely provided the notice to the dependent and or anyone that's entitled to COBRA?
Or just that if the employer is responsible for some element of that communication, just that they understand what is like what would be considered proof of notification, whether it's a sign off of receipt or I know in our business we use first class mail simply because we can affirm that the post office got it, which means that you know, once they have it, we can affirm that it was distributed correctly. Just anywhere where there's an expectation of the employer being a part of that chain of events, I would just make sure that they know what their responsibilities are and what the penalties are for non-compliance.
That makes sense. Okay.
And then probably, or one of the other questions, I noticed there was a pick a date thing. I think it was on the when they enroll for COBRA. I just want to make sure that would have to be something the employer would determine. You wouldn't want to give the option for a COBRA beneficiary to kind of pick their event date. Again, from a compliance standpoint, you know, if they skip a month, right? That's not when COBRA would be eligible to start. And then I would think from a carrier standpoint too, you would want to make sure the eligibility is managed appropriately there. So I'm not sure exactly how that was designed to work, but when I saw pick a date and from a member perspective, you know, I'd probably get a little nervous about that.
So you're saying like this date, the system should automatically assign. We should not allow the employee to choose.
Yes. Yeah. The termination of coverage would be initiated in a lot of cases by the employer.
Yeah.
And that date determines eligibility for COBRA. And then obviously the COBRA election periods, whether it's 18 months or 36, depending on the event. You know, I'm sure insurance carrier is not going to be excited about paying claims at a period that's not really eligible. If it would get changed, right? The other thing here is the employer. So the enroll button, just having like, is the expectation that the COBRA beneficiary would essentially be enrolled in exactly the same coverage that they had when they terminated, or would there be an option for an employee to say, hey, look, I had family coverage or I was in this plan, but I really want, you know, I'm going to elect COBRA for this other plan or this other coverage tier that is available to me.
Well, my understanding is that they, and actually the law states that they have to have the same coverage that they previously had with that employer. And so they have to stay in the same plan that they were in before they were terminated or whatever that life event is.
I mean, it may be different in different market segments. And I could be doing the same research here, but it'd probably be something just to verify. I did see there you could take dependents off as well, right? So if I had family coverage, but I wanted to, for COBRA purposes, I only wanted to cover myself as a beneficiary, that I could do that. And then for the disenrollment, how do they pick what date that they're going to disenroll for?
So I think he's getting to that screen when he shows the disenrollment from COBRA.
Okay.
They don't select the date of the end date. I believe it's going to end at typically in the active employees, when they end their coverage, it ends at the end of the month of their requested date. And so we were going to do the same thing with COBRA. They don't have a different end date.
Probably just let the beneficiary know that, so that, for example, if they're anticipating, hey, I just got a new job, my new job starts in three weeks from now or 2 weeks from now, and that's going to cross over into a new calendar month. The timing of that obviously is important. So if it's going to end date within the current month, either give them the option to determine when they want to terminate their coverage, or just let them know, in that process that coverage is ending.
Okay.
It wouldn't be uncommon for somebody to select a future date, right?
Right. No, it's not. I don't think so.
Well,
I know we have a couple of other.
Cobra has a 60-day election period, so someone could select it short or wait the full 60 days before they take it back retroactively. That is a feature of Cobra. Um, um, it's been my experience that most employers do not want employees selecting Cobra. So I'm curious why one of the options, since we're building this on the exchange for exchange-based employers, there wouldn't be some mechanism to allow those employees to explore other options that they may have, like the individual market with subsidies. It would seem to be a natural for the exchange to allow that, as opposed to get hung up on making sure that Cobra is elected.
Right.
You have to give them the notices and all that kind of stuff, but it just would seem to me that a quoting mechanism for the individual market makes a lot of sense in this case.
It's a good point, John, and that is built into our notices, and I believe it's going to also be built into the system. That is the primary goal. That is a better option for most Cobra participants, but it's definitely in the notices. But we're doing what's legally required and making Cobra options available.
Okay, Glenn. You're on.
Yeah, John, you brought up exactly what I was thinking, that on that portal, on that website, some kind of little note that you're going to get your Cobra notification. You can enroll through Cobra here. However, the Maryland Health Connection can provide potential federal subsidies, state subsidies. You may want to click on this to compare options you have. That's one thing. The other thing, like Wes was saying, some carriers, believe it or not, can actually end the date if the employer wants to end the date of termination of employment. So you got some other factors there, like he brought up, that, having them select a date, it should all like feed back to how the employer's contract was written. And I don't know how to build that in, other than if you have the contract that was set up by the small employer, then at that point that would be kind of filtered into the situation, so that there's no potential liability to the employer. Because let's face it, Cobra, whether you guys offer Cobra or whatever, the ultimate liability falls back on the employer if Cobra is not administered correctly and all the options available. So that was the only couple of comments I was thinking while we were going through this.
Great. Gene?
Yes, is there a distinction, or does the system make a distinction between Cobra required based on the state of Maryland as opposed to based at the federal level? And secondly, when a person does leave, who generates the letter to prove the last day of coverage? So whether they go to the exchange, many times we'll say we want to see the Cobra letter before we can put them in the individual program, or before the employer can take them on. So that's the two questions I have. One is does the system distinguish between state-based Cobra requirements versus federal Cobra requirements, and who generates the letter so that it'll satisfy the requirements of the carrier accepting the person who's coming off the coverage?
I'll take this one. Eugene, it's so we've coded for both the Cobra federal as well as the Maryland codes. So state continuation, that's factored into this Cobra. Even though we use the general term Cobra, it's for both state continuation and Cobra. And then we are generating the notices when Cobra participants are eligible. We have our notices drafted, and it's being programmed into the system right now. And the notices have taken into account both the state and federal Cobra length of continuation. We've gone back and forth several times on this, so that's also been taken into consideration.
Okay. And so the letter will suffice as far as I'm sure with the Maryland Health Connection, just so that the subscriber is not stuck in the middle of saying, I can't get it from the employer, I can't get it from this group. So, the personnel person is out for 2 weeks, and all these kinds of problems we've been running into.
Right. So the notice, when it's the dependent or the spouse that has to make the election, since they can't do it through our system, what happens is they get this notice in the mail, and then they're responsible to respond. There's a election form at the end of the notice that they have to complete and send back to the employer. Then the employer is then responsible for notifying us in the system about that participant's election.
And if the employer doesn't do it in a timely manner, what happens?
Then they're liable for that. They are, and we hope that brokers will advise them, and there will be other folks in between the employer and our system that would be advising them of what the next steps are, and the broker will also receive these notices, so then they can help advise the group on their next steps.
Okay, thank you.
All right, Dinesh. Oh,
Yeah.
wait, we have one more
Okay.
comment from Wes.
Yeah, maybe I just want to go back on the plan elections. So, and forgive me, I can't remember if dental and or vision is being offered through exchange. I should know that. So
They're
again, forgive me.
not. They're
Okay,
not
then
yet.
it's a midpoint then. I know we do all those different lines of coverage, and so there is an option to, select one or more of those benefits when COBRA is elected.
Gotcha. Thank you. All right, Dinesh, back to you.
Yeah, thanks, Mimi. Yeah, just to answer the question, I think I'll go to the employer flow. The employer flow, we are clearly marking it such a way that they can immediately see who is eligible for COBRA and who is already under COBRA. So I'll share that screen shortly. So in the employee experience, let's finish this renewal, which is the last flow. In this, okay, I'll need to start from there. Okay, so in this experience, the employee already is on the COBRA coverage, and they are coming to the during the enrollment time. When they sign in, they will be informed that they are on the COBRA coverage, so they have an option to renew the COBRA coverage, right? So when they tap on it, so in this situation, yes, we are giving them the option like who is covered. Then they also have an option to choose different plan, because this is what current plan they are. So they can see what other plans offered through by that employer. Then they can choose to confirm the specific plan that they are interested in. So right after choosing, again, the plan details and who are the people being covered and the cost and everything will be displayed here. Then they confirm it. That's it. So we made it pretty easy for them just to do a one single tap through the self-service and complete their renewal flow as well. Okay. All right. So this concludes the actual employee experience. It looks like we pretty much went through all the questions. So is there any other outstanding questions that we can answer before going to the employer experience?
One other question. So if the employee leaves and doesn't choose the COBRA, they can still apply for the individual market on the Maryland Health Exchange, because I understand that once you get in the COBRA plan, they can't change their mind and say, "Oh, I want to do the exchange because the exchange is cheaper and I have tax credits." How is it? Because I know it's a little bit murky in terms of which thing the employee does first or second. When they see the COBRA benefits and they see the full rates, they're shocked, And so my question is, what happens if they select it and then change their mind later on? Say, "Oh no, I didn't mean select COBRA. I need to go back to the exchange because I got a better rate because I have the tax credits that I don't get on COBRA."
They can end their COBRA coverage
Mhm.
at any time.
And get on the exchange, the
They
individual
can get
market?
on the exchange, correct.
Okay.
Obviously, to get on the individual exchange, they will need an
Let-
SEP, and yeah, so they would have to choose their SEP on the individual exchange.
So they are allowed to change that. But what happens if they get on the COBRA benefits? They've been on it for 3 months and decide they just can't afford it anymore. Can they go back and say, hey, this is an SCP for me to go back to the individual mental health connection program?
Let me, and maybe Rita might be able to
That,
answer
yep,
that better.
that's not an SEP. If they elect COBRA and then want to come off of COBRA, that does not open an SEP.
That's what I'm getting at. That's
Yeah.
what I'm saying.
So the
What's the
end of
time
the
frame?
COBRA, the end of the COBRA coverage is the proper SCP. So once the COBRA
Right,
has
we know that. Yeah,
completed its length of
18-month period.
continuation,
Right.
right, then they will be eligible to enroll. But if they have any other SEPs, they can, or other qualifying events aside from this coverage is unaffordable to me, then they will be able to enroll in the individual exchange.
That's
Or
where
if,
there should
or
be.
if open enrollment.
Can I say something real quick? That's where I think there should be like a red banner, like flagging, stating once you elect COBRA, you are unable to enroll in the Maryland Health Exchange
That's what I'm getting at.
until you're COBRA. It's exact. That's a great point, Eugene, because that's when that was brought up. They can't just disenroll. They got to carry it out through the full 18 months.
Yeah, I totally agree with that as well.
Okay. Noted. Yeah.
It's a very confusing thing for customers.
I think that's a smart idea as well. It's a common question or request from brokers.
Yeah, I think we will address it. Next revision, I'll show that. When they come in, we can have a clear design, and telling them the both options available. If they choose COBRA, they cannot get back to the individual market till this period ends. So yeah, we can include that as part of this experience.
And they'll let them know before they select COBRA. So they know to go ahead and get this rate done with the individual market. That way, we as brokers don't get stuck in the middle of that.
That is correct. Yes, that is correct.
Maybe, and team, one question too, is this geared for larger employers, 20 employees and above? And just from a nomenclature standpoint, like, or maybe a question, is there any intention to do the same for Maryland continuation, which would apply to groups of 20 employees or fewer?
Wait, are you asking if COBRA is eligible for large employers?
No. So COBRA applies to employers with 20 or more active employees. Maryland State Continuation, which is a very similar type program, is for groups with 20 employees or less.
Less than, yeah.
That's
So-
correct.
So it's geared towards COBRA or continuation or both?
Oh, it's for both. So it depends on how many employees an employer will have, and they have to attest to which one they apply for. So I think Dinesh has a design from the employer's experience that he's going to show us that
Okay.
they'll have to elect. I have more than 20 employees. I am subject to federal. That type of flows in this design, I believe. So let's let Dinesh get through it, and then we can ask her questions.
Thanks, Mimi. Before getting into the flow, I just want to quickly brief the design approach for the landing page for the employer. Then we'll get into the flow. So what you see here is we have when the employer sign in, they can immediately see the current employees, inactive employees, whom they kind of terminated, right, or a different reason who left the employment. Then in addition, we are also going to have a separate section for COBRA and empty state continuation eligible personnel. So this list basically, you terminated an employee, but you did not enroll them into the COBRA coverage. So the reason why we called out this is, as an employer, I don't need to go and find out, who is enrolled into the COBRA or who's eligible for the COBRA from the inactive employees, right? So we want to have this called out so that it'll be easier for employer quickly find out whether they want to enroll them into the COBRA coverage or not. And then the other one is like whoever already enrolled, that'll be a separate list for them. So if they want to take any actions on disenrolling them or renewing their coverage, they can do it easily from this list. Okay. So now, having said that, let's get into the flow. But the first flow is, of course, terminating an employee. Then how do we enroll them? Okay. So this is the flow where the employer decides they want to terminate Ronaldo. So they're just removing the employee. So in this case, we are the employer has an option to choose when is the termination date, then also choosing the reason. So in this case, we are given like death of the employee or end of an employment. Now, employer being asked for are their dependents eligible for COBRA or MD state continuation coverage. And this information will be given in here where they can tap on it to see what are the eligibility, the detail. Of course, then they can choose. In this case, by default, the system will select, but in case if they want to choose it, if they want to change it, they can change it. As you see, there's a disclaimer has been given here on what scenario COBRA is covered and what scenario state continuation is covered, right? If they say yes, then as a next step, the employer has an option to enroll the employee into the COBRA. If they choose a no, still they will complete it. But as you saw in the landing page, we will have a separate section saying this employee is eligible for the COBRA. Okay, so I say yes in this case. So I remove it. So now, since I removed it, now as a next step, we are asking for the employer to enroll the employee into the COBRA coverage. Of course, we will update this since they selected. We don't need to select the date again. Now here they can choose the coverage. Of course, the employer can choose either the entire family or specific person who needs the coverage for the COBRA here. Then submit. That's it. So now, right after completing it, now they can see the person who got enrolled into the COBRA coverage in this flow.
I did want to state, to just clarify, in the beginning of this design, Dinesh, if you can go back to that disclaimer, pop up. I did want to show that we did add like another language, even though this talks about the disclaimer about Maryland continuation and COBRA and understanding that the employer is responsible, and while we're helping with the administration portion of it, that the employer is entirely responsible. But in which cases, which SCPs apply, that's what all of that language would look like. But the employers also must notify the dependents of eligibility in the event of the employer's death, and that's or the employee's death, excuse me. So that's one of the disclaimers we added, because that's when, if the employee unfortunately dies, then we won't have access to the spouse or dependents through the system. And so the employer will have to notify the survivors of the family that they're eligible for COBRA until they find some other coverage. So I just wanted to point this out because it came up earlier. I believe it was Wes or Glenn, I'm not sure who brought it up, but
okay. All right. Now, so that's our experience of removing an employee by the employer. Now, let's say we want to go through the other experience where they can enroll into the COBRA. So the first, let's assume the employer went and removed their employee, then coming back next day or a week from then, they want to enroll specific employee into the COBRA. So in that case, they can just select the inactive employees, and they can this actual actions will come only if they are eligible for, right? So in this case, let's say they are eligible for the COBRA enrollment. So right after tapping that, Now they just need to select the reason, what the reason for the COBRA enrollment, then also the family, who other people will be covered on that. Then while selecting the reason, of course, there'll be a, option given. So for the employee to choose like the date or the specific event date, which we wanted part of the enrollment. And submit, that's it.
But you
Now,
said that date was going to be removed, right? Because they would have already entered that, right?
that's
The
for
date selection.
that is correct. But if it's a different event, yeah, then they have to
Okay.
choose it. Yeah, only for the termination, removed from the experience what we have right now. That's correct.
Okay.
Yeah.
All
Okay.
right. Glenn has his hand up.
So on that one page where they select either COBRA or Maryland continuation, I noticed when they select COBRA, it defines the definition. But when you click on state, it doesn't define the fact that the employee has to be employed. I don't know. I think it's like 3 months, or there's certain rules that are a little bit different from COBRA. And I think, like sometimes it even gets muddy for me, like, you know what I mean, after the ACA. But I'm just saying there are a few differences, like immediate day of coverage with COBRA, the person can get terminated and still go on, but not with a Maryland small group. So I think some of those things and some of the rules on like spousal coverage can go up to 36 months. And the Maryland continuation, I think, is less than that. So there are a couple little differentiators that should pop up when they select that.
Yeah, I think we've accounted for those. And I think that might have been just a glitch that when Dinesh, when you clicked on COBRA, or I'm sorry, the Maryland State continuation and the employer's experience, that language, the disclaimer didn't come up. But I know that's probably just a small glitch that will be fixed.
That is correct. That's correct. Yeah. So that's the experience we have put together. Yes, of course, the copy and language will differ as we implement. Yeah.
One other question.
Oh wait, Wes had his hand up, and then
Okay,
Eugene.
sorry.
Yeah, just a comment on the term reasons. I saw end of employment and death. Make sure you have reduction in hours in there as well, where that can be especially helpful. If you remember, post-COVID, there were a lot of subsidies that were provided. ARA, recovery. I don't remember what the I remember what it stands for, but a lot of the subsidies were dependent on the reason for termination. So reduction of hours had to be the reason for subsidies to be able to issue it out. So just make sure all the reasons are listed there.
Oh, that's a good feedback. Yeah, sure.
Thanks, Eugene.
Yeah, one other thing. So when an employee is leaving an employer and you're giving them the COBRA options, shouldn't we have something that says that if you're leaving employment, you can apply for COBRA or the individual market as a reminder to them? Because they're going to want to know that. A lot of times they just think COBRA is all they have, and once they see their rates, they can't afford it. But somehow it looks like there ought to be a choice, a reminder that says, listen, if you're leaving, here are the two choices you have. You can do the COBRA program, or you can apply through the Maryland Health Connection and apply for an individual as a reminder, because if you don't tell them, they won't know it.
Yeah, I think we talked about this a little bit earlier in our discussion. The notice has that to the employee, the notice to the employee, or anyone that's eligible for COBRA under that employee, who gets that notice will have that in the notice. We'll have that language in the notice as the primary. Yes, from us. Yes. The system, I'm not sure. Dinesh, do we have anything like that in the designs? I don't think we have that in the designs, but I know it's in the notice, and that they have to create an account on the Maryland Health Connection for individuals to be able to continue with that process.
Yeah, because this is easily overlooked. And then what happens is that by the time they get the rate from COBRA, and that's why I asked the question earlier, how much time do they have if they select COBRA? Are they locked in COBRA in the first 60 days? Are they locked, they can't go back to the individual program? What's the cutoff?
Okay, that's a good point. Thank you, Eugene. Wes? Oh wait, yeah, Wes has his hand up.
Yeah, just one other observation too. When the employer, or I would assume with the employee too, there is a time frame for which they can elect COBRA. So just
Right.
make sure that it's not beyond that time frame. If you're given the option, that'll um, I'm sure create issues if they've been extended too much time.
hmm I think Dinesh, this program does have that accounted for, right? And I think it might be in the back end.
Yeah, that's
Um,
correct. Yeah.
yeah.
For example, in this case, like if it's a personnel who got, let's say, terminated, but they are eligible for COBRA, they'll be shown here when that coverage actually ended, so that they know that since then they are they can enroll, right? But this is again from the employer perspective; they want to take action on it.
hmm
Um, that makes sense. And then to answer the other question, like the individual market, though
Yes.
this is from the employer perspective, I think we could, when they choose the when they choose for the enroll into the COBRA, we can provide them that employer also some information. Hey, this employee may be individual market. You could admit,
Yes.
but do you still want to continue? So that way we can capture that the employer has acknowledged that he was aware of this things from the system perspective. We will do that too. Yeah.
Yeah, I just don't want the employee to say, well, no one told me. The broker didn't tell me. I didn't know I could go with the individual market. That's so much better choice. I've heard that 1,000 times. That's a much better choice.
Yeah.
So I'm not looking at it from just the employer perspective. I'm looking at it from the employee perspective of being notified that that is an option at the time that they're in the crisis. They're already in crisis because they're leaving the job or they got terminated already. And
Correct.
this the one thing they don't want to miss, that they had an option and no one told them.
Yeah.
And I just said that makes sense. Yeah. Dinesh, what were you saying?
Yeah, I think the notice is a whole it goes as a offline experience, right? But still we could include it part of this when they are trying to enroll it. We can tell them that this termination notice sent on so and so date, so that the employer knows that notice already dispatched, for them to know before while they are enrolling into COBRA. That instructions, or information we can share with the employer. Does that make sense? I hope.
Yeah, that does.
Yes.
Wes?
Yeah, one other thing just to be cognizant of as well, and I thought I saw this in the dashboard. So there may be employers that don't want MHBE to send a COBRA notice out because they've got another administrator doing it, just to avoid confusion, right? Because if they've got other COBRA eligible benefits, dental, vision, FSAs, and they already have somebody sending out like a complete COBRA packet to that employee, then they wouldn't want something else coming over top of it necessarily. So just be aware that it's likely there's another COBRA administrator in this process for employers that are offering other COBRA benefits beyond just Maryland Health Benefit Exchange.
I see. Okay. Yeah, we didn't take that into consideration, but I know that they could obviously they could opt out of this. This is optional, so I believe if that's something they're interested in using a different provider for that, they can always opt out of this.
Yeah, that should do it.
Yeah.
Okay. All right. So now in the now we are in the second experience, which is the disenroll. So in this case, the disenroll in the COBRA, if the employee calls the employer, hey, I'm having a COBRA coverage now. Can you discontinue from that? I got moved on to a different job. So they can simply come to the portal and select the employee. So again, in this, the reason we are providing this experience is they can have, if they are choosing that specific employee, they can either the specific person can be disenrolled, or even if they just want to do for the spouse. The reason we are showing this self and spouse and child as part of this display is for the employer to know who are the people being covered, because part of this enrollment and disenrollment, we have an option. They can enroll only the specific people who need to be covered. Okay. So we thought it would be easier for the employer to know who's being covered and who is not. So now when they click on the disenroll into the COBRA, then this is the reason being shown, like why it's being disenrolled, or the specific, let's say in this case, Cody Ben. Then they can select the employee who's requesting that coverage and submit it. That's it. So it's a similar experience as the enrollment, but
Glenn, go ahead.
So after the person does the enrollment, and I guess the file feed goes over to the carrier, does the system actually allow them to create how they want to make their payment plan? Do they want to, are they going to be, once they enroll individually, and at that point, how is the billing structure going to work? Because obviously the employer still has this person kind of listed on their group policy benefit situation, right? And they're aware that this employee elected it and is part of their group policy. And if they make a plan change at any time during the year, there also has to be a notification that employee has to be notified as well, that they made say they make a mid-year plan modification change. I guess if they're doing it online through this system, then I guess, is that COBRA person going to be notified? And then how is the billing going to get? Are they going to be able to set up billing and direct bill, where the former employee then goes ahead and sets up their payment so the carriers get paid? How's that going to work?
So I'll take this one. As far as the billing piece, the vendor that will be selected will be administering the billing portion of COBRA, the COBRA piece. So the system will handle the enrollment piece and the disenrollment piece, and then when the participant is enrolled, then the TPA, the selected vendor, would be the one that would issue invoices and collect payment and then remit that back to the carrier. Same with the enrollment, just like as if a new enrollment for active employees happen through the system, that will be on a file back to the carriers, and then it will all get reconciled as well. So it's all done through electronic EDI files.
Thank you.
Wes?
Yeah, I just want to plant this out there as well. So for secondary events, right? So fully terminated, they go on COBRA, and then they experience a divorce. So now that spouse or children, or however that separation happens, would be eligible for COBRA.
that's correct.
Separately, right? Different event, different notification, all that kind of stuff. So I'm sure you guys have thought through that, but just want to make sure that would be covered in the application.
Yeah, that is being covered. Yes, that's the main reason why I showed that in the landing page. You might have seen a section for eligible enrollees as well who has been enrolled. The reason we are calling out the spouse and dependents is that for the same reason which you just mentioned, particularly for the divorce case. Yeah.
And the divorce could be up to 36 months. COBRA.
They are eligible for 36 months?
Up to 36 months in the divorce.
I believe so, yeah.
I'm going to bring that up. Just make sure you remember that. I remember that law, but so if it's still in effect, I think it still is. 18
Yeah.
if you just separate, but if you divorce, up to 36 months.
Okay. All right.
Including a disability situation as well.
Yep.
So for divorce, I just pulled up my chart here. It's 3 years for COBRA, and then it's indefinite for Maryland state continuation.
because you don't want the system terminating and all that prematurely.
Yes, so we've been through this internally. I believe they have this all. They have our chart.
Okay. Just checking.
Okay.
Yeah, thank you for pointing it out.
Yeah. So for the disenrollment, I think, while I was showing the prototype, it showed my different screen. The right out of the user choose the disenrollment. The first screen we will show it's like the disenrollment reason. Okay, so they can choose why the COBRA coverage being disenrolled. So they can choose one of this option before they confirm it. Then it's shown like what are the who are the people was covered in COBRA and now being disenrolled. Okay. Okay. All right. Okay, so we looked at the enrollment, disenrollment. Now let's see what is the removal of employee. Also, we went through it. Now we'll just cover the renewal. Okay. The one other thing I had mentioned, like particularly on the similar to the reverse quiz, we show the dependents. So in this case, Kathy is an adult and she has 2 minor dependents. So we provide that option for them to see it for the minor dependents for that employee. Now, okay, let me go to the renew coverage. Okay, so when I do the renew coverage, this being shown all the dependent profile in case if they want to edit it, they can edit it before they confirm it. Then right after they confirm their family member who needs to be covered part of the renewal, then we are showing them this similar to you saw in the employee experience where we are showing the current plan, what they have, then what are the other plans are available for them to enroll. So they can select it. Now we show them the confirmation page with the enrollment date, then the whole breakdown on the pricing and etc. This is similar to the actual plan enrollment flow, so that the employer is experienced with it. There's no change in it. The experience and the data points all we show it's a similar.
I had one other important question.
Sure.
What if the employee ages out and gets on Medicare and the dependents but no longer be in the group plan? Would that be another reason why they may be eligible for a continuation of coverage? They age out, their employer is now eligible for Medicare, so he's no longer or he or she is no longer in the group program, but the dependents have to be covered. That would be another reason why we may want to have an option, right?
Yeah, that's the federal COBRA.
Is that one of the choices we have there?
That's correct. That's on there. That's built in.
Okay.
Yeah.
Okay, great. Just want to make sure.
Yeah. The spouse and dependents will be entitled to 3 years, beginning on the date that the employee becomes entitled to Medicare.
Great. Fantastic.
Okay. All right. That's all I have, Mimi, for today.
Thank you, Dinesh. Appreciate it. Any other comments? Any other? This was really very engaging discussion, and I really appreciate everyone's input. Yep. Any other comments?
Well, that was a lot of good feedback. Appreciate everybody's comments on that.
I have one thing to ask. So when is the third-party administrator's deadline of selection of who that may be? And you stated that obviously you can't disclose who's been the bidders on it, but when are we going to know that by, and who that will be?
By the next meeting, we'll have a vendor definitely selected and approved by the board, and we will be able to discuss that more freely at that time. But to John's question earlier, I did put in the chat that we're able to confirm that we have received 2 proposals, and we're in the review process right now.
Okay, thank you. Okay, Mimi, I think we can move along on the agenda to what would be the public comments or the open discussion. Anything else for the good of the group today?
I think we're probably all
Okay.
set now.
Okay, well, I appreciate everybody attending the meeting today. That was a lot of information, a lot of good feedback on those discussion topics. Appreciate it. Look for the minutes. If you have any follow-up comments, either to the MIA, which you can make direct, or to the committee through Mimi, that's appreciated, and we'll see you next month.
Thank you, everyone. Have a great day.
Thank you.
Thank you.